I would now like to introduce today's presenters. Manu Argawal, partner, leads Everest Group's business process services practice. He is responsible for the growth of the practice in terms of the client relationship management, delivery excellence, and content innovation. Abhishek Singh, partner, leads the cloud transformation research for Everest Group. As a partner with the firm, he is responsible for growth, client relationships, and thought leadership in North America. And with that, I would now like to turn things over to Abhishek. Take it away.
Thank you. So let's get started. Moving to the next slide. All right, so why are we here today? And I'll probably spend a few seconds talking through how we are going to run this session. As you have already noticed, the topic of the day is leaders versus laggards, how peers can use outsourcing to differentiate. So while we delve into this topic, first up, what we are going to do is spend a bit of time understanding what's really going on in the peer market. What are the business themes that are determining some of the changes taking place in the operating model, as well as the go-to-market of the peers, and how these business themes or changes are related to how organizations or peers themselves adopt operational changes, technology, and digital, so to speak, to help achieve their individual goals. So that will be the part wherein we'll be setting up the context. And then we'll be diving into the meat of the discussion, which is about the leaders versus laggards, which is going to be about bringing out the best practices related to outsourcing in the payer market. So in many ways, you can expect us to talk about what payers are really doing to differentiate. We are not really going to tell you who are the players who are doing that, but more so bring out the key tenets, key best practices, etc. From an enterprise sourcing consideration that help peers differentiate themselves within the market as such. And then we'll be wrapping it up by talking about the supply side of the equation as regards who are the players out there who support the payers in their initiatives, whether it is related to operational transformation or technology transformation. So let's move on and let's get started. So if you see this slide, this is in many ways a numerical or quantitative representation of what has been happening in the payer market for the last 2 years. The left-hand side is the revenue view, while the right-hand side is more of an operating income view or the profit margin view. We wanted to start off with this because in many ways, in the last couple of years, especially because of COVID, this question keeps getting raised around, hey, what is the real impact of what we are seeing out there in the broader market on the payer market itself? And as we can see, even during COVID, as we are looking at all the quarterly numbers on the left-hand side, the average revenues still continue to grow. The premium revenues were growing for the payers. However, if you flip to the right-hand side of the slide, interestingly, we saw the operating margins kind of jump in Q2 of 2020. And I'm pretty sure you have this question in mind, why that interim peak in between. It happened because all of the elective care elements, which used to comprise a significant component of the care or the claim costs, dipped significantly. And for a moment, it did seem like payers will make a killing out of it. Only that these festivities lasted on only for a quarter, and suddenly COVID care expenses started to rise and eating into the operating margins. So that's the view I have. Manu, I don't know if you have any other color to add to what really happened in the last 2 years.
Sure, Abhishek, and I think that's kind of spot on, right? So Q2 saw the highest kind of a fallout in terms of the elective care procedures. So, but what's happening is what we're seeing in the market is as patients become more confident, as the hospitals and facilities start becoming more accessible, a lot of that care is now coming back into the picture. So there's a lot of pent-up demand for urgent care services, for emergency services, anything which was not happening during the COVID times. All of that is now coming back into the industry, and that is what is putting the pressure on the operating income back again. So two key consequences of that. First is when you think about the operating income levels, the margins for the entire industry, there is an increased push towards driving these margins up and getting them back into healthy levels. And while the revenues are still growing, but the ability to influence those margins through revenues alone, that's somewhat getting limited. So what we're seeing from the payer side is they're increasingly looking at ways to cut down on their basic cost structures as well. And we're going to talk about how they're doing some of these things in the next few slides. The other thing that also happened in the last few years is basically a lot of payers went through major mergers and acquisition, and that put specific growth numbers or specific cost takeout numbers as their agenda, and hence they had to deliver against those as well. So not is it just the market dynamics playing out, but it's also some of those committed street numbers that a lot of those payers need to adhere to, and hence the overall push towards bringing the operating cost down.
Yeah, indeed. And that is why as we go through these slides, we'll be going a level deeper into each of the aspects of how payers business operates. And you as a payer executive, if you are listening to this, while this is a kind of a sample set comprising some of the largest payers, but I'm pretty sure it correlates to even those payers who are not part of the mix, and we have seen that being validated. And another point which is visible here by way of way of continuing the same discussion is how when we look at the enrollment view and take a look at this slide specifically, how the membership numbers as they kind of split by commercial versus government have changed in the last few quarters that we have been tracking them. Now, there is a story behind this too, and we need to understand those from the perspective of what's really happening. One is this question of, hey, did the growing unemployment during the COVID scenario have an impact on payers? And the answer is yes, to an extent, yes, because as you see some of the numbers as regards how commercial versus government enrollments distribute within payers, there was a kind of tipping down when it comes to commercial enrollments as employees dropped out of employer coverage. While at the same time, there are a lot many more people who are picking up Medicaid, and that is why we see some of the numbers pick up in the government area, in the government enrollments. Now, there is another aspect which is not very clearly visible from the data point, but is more being understood from the perspective of trends taking place on the group coverage or the employer-based commercial plans that a lot of large payers rely on as part of their business. We are seeing an increasing trend. Let's stay on the last slide for a moment. We are seeing an increasing trend in terms of a lot of large employers trying to take up the onus of healthcare benefits themselves. And hence there is this growing trend towards self-insured employers who tend to use payers only as administrators or administrative services only. And while this is not a new phenomenon, we have definitely seen this pick up in the last few years, and that is why we believe that the gray line that you see will continue to taper off. And in many ways, as these payers engage with large employers, what kind of offerings they bring to them, whether it's tech-related offerings or how they evolve their administrative services only offerings, how do they deal with enrollment? There is a lot of thought process going into that. So while it is true for the large payers, it will continue to be true for mid-sized payers who deal with employers. And as this trend continues to establish itself, we will see more and more investments going into building out that side of the house, which will continue to grow. Manu, any thoughts on this one?
Yeah, and Abhishek, and as you rightly point out, right, this speaks volumes to why a lot of payers are now getting into the third-party market. There's a lot of acquisitions happening in that space. There's a lot of investment rolling into those, right? Some health plans are developing third-party administrative capabilities in-house, while others are just going on an acquisition spree. You see, in fact, a lot of service providers now are starting to cater to that part as well. So TPA market, which erstwhile in healthcare wasn't that strong, is now starting to pick up. And then the other trend that is also playing out because of this particular shift towards the membership base is traditionally Medicare Advantage or some of the Medicaid plans, they haven't really been that profitable. Right? The profitability for those plans tends to be materially lower than the commercial plans. And even more so, if you think about the health plans who operate in the Medicare side, there's a huge variation between those who can actually make some profits out of it versus those who are just completely making losses. And that basically is the essence of our webinar today as well, that how do you actually differentiate, what kind of capabilities do you kind of put in place so that you are actually making some profits out of it. Because if you are a large health plan or even a mid-size or a small health plan who has significant base in the Medicaid and Medicare side, your ability to make profits out of this is really going to be hinged on how you manage your costs better, not just in terms of how do you grow your membership base, because traditionally your revenues are capped at certain levels.
Absolutely. Let's move on to the next, because in many ways now we are building out how players are starting to think and what are the key themes that are impacting them. So Manu, let's hear you talk about some of the key business themes, which beyond what we have already discussed are going to impact players in the future.
Yeah, and I think when we're thinking about some of the business imperatives, right, that the health plans and the industry has had, what we started looking at was what is it that the industry was really talking about the second half of next year versus what are those new themes that are coming up in this year. So 3 themes that came up, which are still fairly important. The first and by far the most important one is improved access to care, whether it's through continued investments in programs like telehealth and home care, which were really popular during COVID times, and they've generally seen an overall uptick. Yes, the market has returned to somewhat of a reduced volume post the COVID era, but it's materially higher than what we saw in 2019. And similarly, there are other partnerships, product launches, collaborations with the provider community, et cetera, that's really driving improved access to care at the heart of it. The second aspect of that is also how do you improve your overall operational efficiency, whether it's utilization of healthcare services, getting access to the right physicians, right facilities, and making sure that your members are staying in network, they're getting access to the best cost at the most affordable prices, while also helping the payers plan their internal care costs much better. So especially during the COVID-19 era, with so much boost towards the vaccination, so much new care facilities coming in, a lot of these getting covered by existing insurance, how do you kind of ensure that your patients are getting access to those right facilities while at the same time managing their care on a long-term basis? And then the third theme, which again was very important last year, is improving the access for members or engagement with members. So members have always had this confusion in terms of what does their plan cover? What kind of benefits are they looking at? How do I actually improve my health outcomes? When do I go for my preventive care versus when do I go for reactive care versus something else? And this, in general, a lot of confusion in the minds of members. So from a health plan perspective, can we engage with our members better, help them understand their benefits, help them manage this journey better as compared to just leaving them in the dark and then hoping that they will figure this part out? So these are 3 key themes that we saw in last year, which are continuing to be important this year as well. And then in addition to these 3, sorry, Abhishek, if you want to add something to that, and then I can talk about the new themes.
Sure, I just found this very interesting as you were talking through the 3 themes on the right-hand side, because as you were alluding to on the last slide, this whole aspect around how payers need to work on their cost equation side to ensure that their businesses continue to be profitable. So like something like the Medicare, Medicaid side of the business, which are traditionally not the most profitable side of their operating model. Now, the question here is, as we look at some of the key business themes, which is around enhanced member experience, expanding the Medicare Advantage, improving access to care, operational efficiency, almost all of these themes almost end up validating what you were stating already, because if payers have to improve their top line, I think there are enough avenues available, but what are going to be those swim lanes which will be impacting the top line as well as be profitable for them are also questions that they will be dealing with. And in many ways, the technology investments that are going in are solving 2 sides of the equation. One, trying to keep costs down while also trying to monetize various new elements of interaction with patients, going beyond the care setting and looking at more of an integrated, coordinated, more of a life cycle of a patient rather than just in those situations where they are interacting with care systems or hospitals or in-house. So I think those are the themes that stood out for me when you were talking through it.
Absolutely, and actually that's where when you think about the left side of this page versus the right, the one shift that you see is immediately from member engagement to member experience, right? So last year was all about, hey, how do we engage members in times of crisis? How do we help them understand? Now it's about how do we proactively enable better experience through integrated, coordinated services. And this is not just across the point of delivery. It's not just in hospital. It happens much before that. So it's all the way starts from actually right now, because we are in the enrollment season, right? This is the time when a lot of members are making choice on which plans they want to kind of go into next year with. So how do I understand the benefits today, right? How do my change of life events are going to impact my healthcare costs for the next year? And how do I make the right decisions that is going to be advantageous for me and my family as I head into 2022? And similarly, on those lines comes the things around, okay, who's eligible for Medicare Advantage? We're going to talk about in a couple of slides the kind of changes that CMS is proposing, the kind of impact that's going to have on the Medicare Advantage side. And similarly, the COVID-19 vaccination rates, continuous push from the government, from the employers now to get the vaccination available to as many employees and as many people as possible. So that's another initiative that is really on top of mind for each and every health plan, which is really going to be front and center for end of this year, as well as heading way well into the next year as well. So one of the things that we did talk about quite a bit is the entire care and the clinical side of the conversation. So what we wanted to do was look at how the healthcare industry has typically been spending money. So if you think about the overall cost structure, right, about 25-30% of the healthcare costs go toward prescription drugs, another 25% towards physicians, 15 to 20% in outpatient, 20-25% in inpatient, and only 15 to 20% actually goes towards admin and IT. But if you think about how outsourcing and sourcing practices have evolved over a period of time, about 95% of outsourcing has traditionally focused on what we call as that admin and IT costs. So only 15% of the spend is actually attracting 95% of the outsourcing behaviors. And this is clearly a huge kind of a dichotomy. Because what's happening is, while those are the costs that traditionally have been most under a plan's influence, how a lot of providers can operate and they can influence those costs, but it does not really cut the mustard as you get into the next age of the healthcare era. And that's where the focus really needs to start shifting towards just managing those admin and IT costs better to actually influencing that 85% of the problem, which is the medical cost. Be it through managing your payments better, through getting better access to care to the patient, so there's overall improvement in quality of care and less claims in general, or it's about better utilization, clinical monitoring programs, fraud and abuse, etc., etc. So in general, you'll see a lot more of the outsourcing and the sourcing pillars shifting away from now the admin and IT costs, which has kind of been done to death, now towards the more clinical and medical cost side. Abhishek, anything you want to add there?
Oh, indeed. I mean, I could not think of a better way to describe the problem at hand and the way payers would indeed need to solve for it. Because as all of you who are listening to this discourse are aware that the question of value is what most constituents of healthcare are trying to deal with. The problem comes to bear when folks have to start defining what value truly means when delivering care. And what we are seeing on the left-hand side of this chart indeed are some of the components through which the determination of value starts happening. Let's move to the next slide, because in many ways we can start relating the cost side of the equation with the value side of the equation as payers have started to think about it. And by the way, let's keep in mind, what we are talking today here is more from the perspective of how payers can leverage external players or outsourcing to deliver on these. So keep your questions coming from the perspective of what can be the role of external participants in delivering that. So coming back to this whole dichotomy about dealing with the cost side of the equation versus the value side of the equations, there are three major functions on which we see organizations starting to define tenets of value, which are mentioned right in front of you, which is care management, care financing, and care operations. And all of these are touch points with which you and I, as patients, deal with. Irrespective of whether you are here as a payer executive, I'm pretty sure all of you also deal with payer organizations in these settings, whether it's in terms of what you pay for the care that you take, how the overall life cycle of care is managed as you deal with different touch points in the care ecosystem. And internally, obviously, the care operation side might be a black box for you, but there is a lot happening within the engines of payer organizations, provider organizations, how they are coordinating, collaborating to make that happen. Now, in all of these functions, the approach has started to change significantly with patient experience now coming at the center. So while you and I probably scoff at individually at times as regards, hey, we haven't really seen patient experience improve significantly, but if you start going back few years, few decades, there is a significant change that has taken place. But what we are now starting to see is that some of this change is getting accelerated. And that is what you see mentioned here on the bottom of the slide, is in terms of the old approach versus the new approach that most leading players have started to adopt and migrate towards. So say, for example, any approach to care management or care financing, it's not a one siloed, one size fits all kind of an approach. Most organizations are not trying to customize it and tailor it to individuals, demographies, catchment areas that they deal with. Because at the end of the day, the definition of value or the definition of experience correlates well with individuals and not just a wide or a generic definition of what these two elements might mean. And hence you need to define specific metrics on which you need to show outcomes. And even in dealing with specific individuals, their definition of experience might be very different from how organizational or corporate definitions of experience are there. So that's one aspect. And that is why from being transaction or volume based, this approach is changing more towards demonstrating value. And from segmented and siloed systems that organizations used to have earlier, they are not trying to take a more unified view of all the operations that they run. So whether it is from the perspective of the view of the patients, going down to the level of how they can deal with unified billing, how they help deal with different touch points, whether it is in hospital settings, outside of the hospital settings, or even beyond the settings of morbidity, which typically payers end up dealing with. So that's the kind of vision that leading payers are adopting in order to transition to the next wave. And that is where this whole question of leaders versus laggards will come in, because the payers who are going to adopt the new approach that you see mentioned on the right-hand side of the value equation will gravitate away from the pack which continues to rest with the old approach. And in many ways, how they engage with external participants, how they engage with their internal technology systems, etc., is going to be very important. Now, in all of this, technology and operational transformation is going to be key. And that is why if we start taking a look at different elements that lie within the three major functions that we just touched upon, is going to be important. So let's go to the next slide and try and give you a view around what will it really take for payer organizations to bring about the significant change that we are talking about. Now, this slide in many ways gives you a picture of what is called technical debt. Now, for some of you, that question might be there in your mind, what really is technical debt? Technical debt primarily means the amount of investment from a technology or operational transformation that any organization needs to put in their value chain elements in order to bring them to a level which can truly be called best in class. And that is what payer organizations need to start looking at within their ecosystem. So like if you see here, we are trying to give you in many ways a messy view of different operational elements or the value chain of their go-to-market operations. So starting from product development, going down to claims management. And as you can see, looking at the legend, the technical debt varies from low to high across these. So there is no aspect of the payer's value chain which is untouched by technical debt, which tells you there is a lot that needs to be done from an operational transformation perspective and tech transformation perspective, which will move the needle for payers to really advance in terms of whatever objectives we were talking about in the previous slide, either from a value element or even from a cost element. And all of these aspects need to be worked out together, because at the end of the day, we are trying to talk about a comprehensive view of what you do with your patients, and hence leaving any side alone or untouched from this technology transformation initiative can simply derail the objective that you're trying to achieve. So the question here is, how do we solve for it, and what are going to be the real triggers? What we have seen so far is that while portions of what really nudges payer executives to take up transformation in any of the areas that you see here are driven internally. So there are organizations who take up the call of making these objectives strategic for themselves. But then there are objects or influences which come from outside. And a big portion of that is regulations, how governments themselves have nudged organizations to bring about those changes. And that is what I wanted to touch upon first, because in many ways, regulations, as they touch all of these elements of the payer value chain, are more cross-cutting in nature than any of the things that we have seen so far coming from within payers. So Manu, I don't know if you want to talk some bit about it, because in many ways that's going to be the base or the fundamental pillar on top of which other strategic initiatives are likely to take place.
Yeah, and let me start with an example there. So if you go to the next slide, if you think about some of the changes that CMS has proposed over the last year, right? So these are the changes that are now coming into effect with this enrollment season. So from the enhancement in the telehealth coverages to the risk adjustment payment calculations, star ratings calculations, even rules around patient access and interoperability. So CMS on an year-on-year basis has been ruling out more and more changes in terms of how they want payers and health plans to function and interact with their patient and the member community. So a lot of these changes are coming in meaningfully. But what we also saw is that if you think about how in payers' internal technology systems and operations are set up, there are two specific areas where they're really ill-equipped to handle some of these changes. Those two areas include the member experience and engagement piece, as well as the risk and compliance piece. And these are the two areas where we're in fact seeing the role of third parties becoming more and more relevant. So when you think about member engagement, it's about how can I interact with my patients better? What are the patients really thinking in terms of the pain points? Throughout a health plan life cycle, what are those various stages in which I'm engaging with those members, or I should be engaging, but I'm not really doing an optimal job? Be it as simple as saying that, hey, I'm getting a claim statement from my payer and I'm not really able to understand what that is, to all the more complex settings in terms of I'm maybe in an out of network setting and which facilities I can visit, what's my benefit package looks like, et cetera, et cetera. So a lot of these changes are actually enabled by CMS to make sure that the members are actually front and center in this entire conversation, but at the same time requires material transformation from payers and health plans on the back end to enable and support those kind of transitions.
Super. And that is which leads me to ask this question to myself, is that if this is already happening, payers are already paying attention to, hey, these are the elements within which they need to work with external vendors, technology providers, etc. What are the considerations that they have really? And that is what I think creates an interesting segue into our next section. Let's move to the next slide, wherein we'll start talking through some of those elements of enterprise sourcing consideration. So before we even dive into that, since we are already talking about some of the elements or the factors that nudge organizations to think of external partners, outsourcing vendors, technology providers, so that they work with them to achieve the objectives that we just talked about. These are some of the ones, like the 7 that you see mentioned, that we have seen come up most often in our discussion. Now, this is a question for you, and we'll expect you to answer this in terms of what you see in your experience. Which is among the following the most important factor that determines your relationship with outsourcing vendors? Is it cost reduction? Is it access to better technology or operating model? Do you want to engage with vendors for better insights or analytics, or gain specific expertise that you lack in-house? There could be other elements, like there are some payers who think of impacting top line growth, because of which they end up working with strategic vendors, or there could be aspects related to improving agility, flexibility, or even process improvement or standardization. That could be key elements of why you would want to engage with external vendors. So take your time and respond to this before we start talking about how we really see our clients actually relate to it and these parameters. All right, interesting the way I see the poll progressing. So we'll give a few seconds, after which we will close the poll. All right. Okay, interesting. So here is the rank order. Access to better technology or operating model seems to have trumped others. Obviously, cost reduction seems to be another important area that the participants think are important factors for them to work with external vendors. Any surprises for you here, Manu?
So honestly, this kind of aligns well, right? So if we go to the next slide as well, what we'll see is what we have been seeing in the industry. So if you think about how the industry stacks up, and this is based on interactions with possibly dozens, if not hundreds of payers, is cost reduction and technology access does tend to be actually pretty high up. The one thing that I was expecting to see as much higher is maybe the entire process improvement layer as well. And maybe that's a function of the kind of audience we have here as well. But that by far is actually one of the things that has been somewhat of like a priority order, which has really accelerated over the last 3-4 years. So what basically happened is, if you think about how the payers used to operate, where a lot of the outsourcing activity was in terms of cost reduction, now they're saying, hey, in addition to cost reduction, help me standardize my process so that I can do it end to end, right? So that is the one place where I think there were some surprises. The other thing that I'm noticing is that other of the aspects which are comparatively much lower down on the priority order in the survey, when we talked about it to the payers, the delta was not that significant. So yes, those are comparatively lower, but maybe the delta is not as high as what's coming out in the poll here. So that's interesting to see.
Interesting. And any other aspect from what you see, because in many ways, when we talk about sourcing, digital is kind of huge these days in terms of how organizations think of working with external vendors. So any of these parameters that you think are more important from the perspective of how payers would want to deliver on their objectives related to digital, as you have seen in some of the customer interactions that we've had?
Yeah, and Abhishek, what's happening on the digital side, it's become such a pervasive term that today you can't really sign a sourcing contract without a layer of digital in there. The definition, the adoption layer might vary, right? You might be talking about 10 bots here, maybe a couple of analytics dashboards on the other side, maybe a more holistic AI solution. So the variation might be there, but end of the day, if you are a large health plan or an outsourcing vendor who's going down a cost reduction agenda or an access to technology piece, how do you really do it without bringing technology? Because if you think about everybody else in the industry who's doing automation at scale, can you really do processes and BPO and technology services, etc. these days without having a strong layer of that? So the way digital is working is it's basically embedded into each and every contract. The question is now the extent to which we're going to go towards it. To what extent are we going to make it front and center and the core value proposition, versus to what extent is it going to be a enabler on the background? But essentially, we've rarely seen contracts getting signed these days where there's at least not some component of digital already baked into it.
Indeed. And I think you alluded to a very important point, and I think this is something that all of us would agree, is that this whole usage of the term digital might seem like a catch-all term with a very standard definition. In reality, it is not. Different stakeholders, different organizations have their own definition of digital. They define the key metrics aligned to that themselves and evaluate themselves on the objectives, the outcomes achieved out of it. And that is why it becomes very difficult to put a pin on what really is digital transformation in many ways, till we get to a time wherein the payer organization has to start defining a standard platform philosophy, standard architecture. There are certain operational processes that become so well oiled that you have a clear definition between what is digital and what is not. And that is why if we move to the next slide, it many ways brings out this conundrum that healthcare care executives are dealing with. So let me give you a brief background into what this survey was before sharing the nuances of the results. So we ended up asking around 73 senior healthcare executives as regards the outcomes that they achieved on their digital initiatives. It was for the period between 2015 and 19. Surprise, surprise, 78% of them ended up saying that the digital initiatives that they embarked upon did not achieve the desired results. So there were certain metrics that they had defined on which they could not get the right outcomes. In certain cases, it was very difficult to measure some of the vague metrics that were agreed upon, like the question of value that we keep talking about. So all of these are aspects which led to not being able to achieve the desired results. So one part of the question was, hey, are they measuring for the right outcomes? Or can those outcomes that they have agreed upon, could they be measured? That is one thing that the industry is trying to solve for right now. But even while going through the process of digital transformation, there were 5 key issues that most executives ended up talking about as the major inhibitors in achieving the success that they wanted to achieve. And as you can see this stacking order, in many ways, the biggest one obviously was business casing aspect, which I was just alluding to in terms of, hey, say, for example, I want to really go ahead and transform my benefits administration platform. But when a CIO takes this objective of benefits administration platform modernization to, say, for example, their CFO, the response in a lot of situations that they were getting, and I'm sharing a real example here, that, hey, we are anyway growing 60% year on year on Medicare Advantage, and you're talking about transformation of my Medicare Advantage platform. Why do we really need it? So in many ways, since the financial equation gets confused with the transformation equation and does not correlate well with how technology investments is already really going to enhance the financial side of the equation, in many ways subsumes this whole aspect of transformation or digital transformation. That was one of the major reasons. So while there are other reasons, what we wanted to touch upon today was the vendor partner side, which is mentioned on the left-hand side, which was also mentioned as one of the major reasons why these executives were not able to achieve the true objectives, which in certain cases was around how contracts were designed, whether or not the parameters, the sourcing considerations that we were talking about in the previous slide. Can we go back to that slide for a moment? Slide number 30, yes. So take a look at these. A lot of the dissatisfaction with vendor partners relates to the kind of expectations that they had around access to better tech, better insight analytics, etc., which these organizations were not able to achieve. And in many ways, the ones in the blue dot ones, the new outsourcing levers, are where we are witnessing a bit of a semantic gap between what enterprises expect and what they are actually able to transcribe onto the contracts, which means, can they describe it clearly enough for the responding service providers to agree to it? And secondly, can both of them mutually agree to measure it in an appropriate manner? So that's going to be one of the most important aspects of how contracting with outsourcers is going to happen. And that will in many ways probably improve some of the satisfaction around achieving digital objectives. Let's move on to the next slide. Yes. So the question here is, we talked about the contract side of the equation, but since we are on the topic of digital and digital transformation, we also need to talk about what really digital means, because we were alluding to this fact that the definition of digital in many ways is not clear. It varies from people to people. What we are bringing out here is the fact that while the digital front door, what you see mentioned on the right-hand side, ends up taking a lion's share of what gets talked about when it comes to digital, the reality is none of what you see on the digital front door side can succeed operationally unless and until you have what you see on the digital for efficiency, which is the orange, and digital enablement kind of fixed. Because all of these work in a single stack. the patient engagement or omni-channel experience cannot work unless and until you have the security aspects in place, you have the data engineering and productivity feeding into the seamless experience aspect that we are talking about. And we came up with this interesting term called digital plumbing, which you need to fix first before you even start talking about digital front door, while keeping patients at the center, ensuring that you have the digital front door in place, ensure that the back office and core mid office aspects of how you define digital are given the right, if not the same impetus as the digital front door. Manu, I don't know if you have any color commentary to offer on the basis of what you have seen in some of our client engagements.
I think Abhishek, you made a very pivotal point here, right? That while digital takes such a nebulous term, but really defining it in terms of how do you enable these services, what are the specific steps you take, the change management aspect of it. And the most important thing is that even as you're defining all of those things, how are you aligning the outcomes? Right? Because it's one thing to say, hey, I want digital, but the other another to define that what do you really expect out of it. So getting beyond that initial hype of, hey, digital is here, it can solve all my problems. Let's really talk about what it is. So from whether it is on the front office side with the front door pieces, the efficiency piece, or the enablement piece, unless those outcomes are crisply defined in terms of these are the expectations that I have, either it's going to help me reduce my cost structure by X or improve my efficiency by Y. Unless we define those outcomes upfront, we are basically signing up for a lot of hard work. So it goes back to the points that you were making on the previous slide as well. So 100% agree.
Indeed. And the good news here is, this is a picture that we created a few years back in terms of nudging our payer side friends to start thinking about how they need to embark upon their digital transformation strategy. We did a good bit of evangelization of this concept, but it took COVID to, in many ways, to nudge organizations to start thinking about it. And if we go to the next slide, these kind of approaches that we saw payer executives adopt in response to COVID in many ways brought to bear what we had already started talking about a few years back. So while COVID created a contingency situation, this whole free swim lanes aspect of how payer executives started to respond for it. So there were certain aspects on which they had to think of a rescue mentality, whether it's related to SG&A expenses, talking about financial risks, operations, etc. Then there was a revitalized mentality, which probably relates most closely to the digital front door aspect, wherein there was strong impetus being paid to, hey, in a situation wherein we are not out there, our brick and mortar models are getting disrupted, how do we think of patient experience, care delivery, or even workforce management, which is from the perspective of the clinical workforce out there, from the perspective of digital transformation. So while a lot of lip service was being paid to digital, a lot of that started to come to bear during the crisis, the COVID crisis that we saw. And last but not the least was this whole aspect of resilience, because the digital plumbing aspect that we were discussing and debating were kind of core to how any digital front door objectives would be achieved, and hence greater focus on infrastructure, greater focus on business agility and platforms started to play out. Now, what that led to is in terms of contracting with outsourcing vendors is interesting to see. So if we move to the next slide, there are three questions that in dealing with outsourcing vendors, most organizations deal with: the question of economics, the question of operating model, and innovation. So while run aspects and the outcome aspect have been kind of table stakes or in certain situations differentiators, what has really started to change in terms of payers outsourcing contracts is this whole aspect of risk ownership. And this is happening because the questions now that the payers have started to ask, at least the leaders have started to ask, are becoming very different or nuanced. So like within economics, it's about how do I free up capital to fund innovation? Because if I'm not able to get the capital funding from my CFO, is there a way I can raise capital from the market through vendors or in joint collaboration to make my objectives real or fund those objectives? For operating models, since we are talking about new product launches and doing those product launches much faster, the question here is, can my product launch sprints keep up with the business that is there? So if we are talking about Medicare Advantage, we are talking about self-insured plans, ASOs, etc., can we do that? And last but not the least is the question of innovation, which is in relation to, hey, given I'm sold on technology, I want to make all the investments in technology, but what if I need to make another significant technology refresh 5 years from now? So do I put all of my eggs into one basket now and work with the likes of, say, for example, an Amazon or a Azure or a Google and make that choice right now as the default platform? Or do I hedge my bets to ensure that I deal with innovation risk myself? And what portion of those risks do I have the service providers take up? So these are the considerations that we have started to see come up. Manu, your thoughts, and you can take it away.
Yeah, I think Abhishek, you kind of covered it well, right? So what one piece I do want to add to all of this is, and this is really becoming a hot button topic for at least this year and possibly continuing for the next year as well, is the entire talent part of the picture. So if I go to the next slide, what we're basically seeing is, in general, talent in the healthcare industry hasn't really been in kind of high supply. Like the demand for talent has always outpaced the supply part of it. So on the left-hand side, what we basically looked at is the entire layer of customer service and experience layer that you really require in the healthcare industry. And what we saw is that if you think about the proficiency level of those talent bases today, the expectation today was fairly simple, right? They need to have some very basic problem solving skills, some kind of domain expertise, and maybe emotional intelligence, and that's about it. Right? But what we're expecting is that over the next 4 years, the agents of tomorrow are going to be expected to deliver on a lot of these parameters. They need to be able to manage multiple channels. They need to be able to work with digital tools. They need to have a lot more empathy towards their members. They need to have a lot more expertise on the healthcare side, as well as they should be able to problem solve on the go with the patients in terms of the kind of reaction they're seeing. So overall, what we're hearing is that the proficiency levels expected out of a classic customer service agent is going to rapidly increase over the next 4 years. And at the same time, what we're also seeing on the right is the extent of skill gap just keeps on increasing. Because whether you look at any of these services, whether it's actuarial, the policy creation piece, the policy servicing, underwriting, there's a significant gap in terms of what is available out there in terms of talent pool versus where do we see the industry headed towards. And couple this with all the major challenges that we're facing in terms of talent attrition and retention this year, the talent part of the picture is really becoming that hot potato right now, which the entire industry is trying to tackle through. So let's look at how the industry is basically going through some of those changes. Now go to the next slide. So here's a typical 4 type of responses that we see from the enterprises. So on the bottom left, you have what is called the ostrich response. That, hey, what attrition, right? We don't see any attrition. This is a short-term blip. It's probably going to go away. We're absolutely doing fine. Our suppliers are doing fine. Thank you. We don't need to worry about this. So that's the ostrich response. If you go a little up, you basically see what the headless chicken is about. So we don't really have an awareness of the issue, but we really want to do something about it. So we don't know what we want to do. We want to do this, let's try that, let's try something else, right? Whether it's getting into new locations, whether it's experimenting with the suppliers, whether it's just outsourcing a lot more, whether bringing it in-house. All the options are on the table, but we don't really know what we execute. So that's the headless chicken. On the bottom right is what you actually see the sheep response, that, hey, we know there is a issue that is happening in the industry, but yeah, we don't really want to make too many changes. So if we think the price increase is 20% because that's what the employees need, let's just give that. At the same time, if we think that our employee base is not really kind of growing, we will need to kind of go out to more suppliers and just outsource it, let's do that. So whatever the response that comes to us is, that is the direction we're going to go to without really questioning the want, the need behind it. That's the sheep mentality. But the last, where most of the players would want to be, but only a fraction of them today are, is actually the top right, which is the wolf, right? So yes, there is a 15% wage increase happening in the industry. But what does that translate to in terms of my prices? It's not 15% for sure, because there's a lot more price components which are also seeing a downward inflationary pressure. Similarly, yes, we know that there's a more diversification needed on the talent side. whether it's for business continuity, whether it's to gain access to talent, whether it's for other reasons. But what are those right locations I need to be present in? Who are the right service providers in those locations that I should be working at? And last and foremost, how do I plan this out? What are those steps that I need to execute? What learnings do I have in the, let's say, the first 6 months, year of deployment, and then how do I reassess and repeat that success? So that's the mentality that a lot of plans would want to be in, but unfortunately, only a fraction of them are actually able to get there. Abhishek, I know you're smiling. I'm sure you want to add some things.
No, it's such an interesting representation that anybody who looks at it cannot avoid smiling. But let's move to the next slide, since the question we started off with was in trying to identify who are the leaders versus laggards. So in dealing with all of these questions, that dealing with the digital front door versus the digital plumbing question, dealing with the talent question, dealing with how what are the different enterprise sourcing considerations related to risk. How are leading organizations really going about engaging vendors? And this slide in many ways is the encapsulation of that model, which if you look at the left-hand side, the traditional model of dealing with strategic tier 2 providers and staffing providers, that stack or categorization that organizations traditionally have, it's still there, but leading organizations are shifting more towards the right-hand side, which is what we call the slots model, wherein you start looking at different aspects of your sourcing needs from a best of breed approach. So from a staffing perspective, from a legacy aggregation, orchestration of different technology, or even looking at operational or technology transformation lens, and even specialist skills or requirements that you have. So in many ways, this is the encapsulation of the approach from a vendor management or vendor selection perspective that we have started to see in the peer market, which we see the leading peers go ahead and adopt. So the equation is changing from cost optimization to business value and growth. And if you as a peer are thinking as regards how we are going to deal with it, probably this is the framework that you will also have to adopt. And that is why if we move on to the next slide, yeah, let's go to the next slide. Yeah. So we, as Everest Group, we have dealt with various aspects of the sourcing within peers or the healthcare market. So if you see here, there are some 10 segments that we have mentioned, and these are not the only 10 segments that we operate in. Now, if you are interested in understanding how to engage with vendors in any of these areas, get more details around who are the key players, how do they operate, specifically from the perspective of the slots methodology that we were talking about, now is your opportunity to go ahead and make that selection in terms of getting more information on that. We are offering you this one-time offer of getting an access to one of these reports and even a conversation if you are interested in. So feel free to select and we'll be happy to get in touch with you and respond to this. So yeah, so if you see here, these are the segments on which we have spent a good bit of time going deep as regards the supply landscape, different aspects of sourcing, how sourcing itself is evolving. So if you are thinking of making decisions on any of these areas, feel free to get in touch. I don't know, Manu, if you have any additional comments to make on any of the topics that are listed here.
Yeah, I think the one only slight comment I'll make here is that, so this list of topic in itself is, by the way, evolving quite fast, right? So till a few years ago, the primary focus areas was things like, okay, what are we doing on digital side? What are we doing on BP and operation side? And maybe a couple of other things, but that's it. What we're seeing now is increasingly the supplier capabilities are becoming more and more verticalized and domain specific. So you will see a very different mix of suppliers when it comes to automation solutions versus analytic services versus clinical and care, payment integrity. Similarly, next year we will plan to cover a lot more of these services as well. So in fact, if I go to the next slide, what we'll also look at is how are some of these suppliers really faring it across a lot of the peak matrices that we have done over the last 2 years. So this includes a combination of all the peak matrices that you saw. yes, there will be the top 3, 4, 5 suppliers that you will see as being almost an omnipresent behavior. So from the Optum, Accenture, Cognizant entity, these are the players who you will see operating across multiple aspects of the industry. But then at the same time, you also see leaders further down the list who are very specialized in those individual capabilities. So as a health plan, if you're looking to make a decision, it's always a question whether you want to go with somebody broad-based who understands your entire ecosystem versus focusing with a specialist who can really go deep into one specific ability or capability that you most desire. So that's one of the key questions that we are getting from the health plan pretty much on a day-to-day basis now.
Yeah. So this is a snapshot of some of the analysis that we have done, but in the interest of time, since we have just 4 minutes to the hour, Manu, let's go ahead and take some of the questions that have come our way.
Absolutely. Let me just open that up. Okay, so the first question, and Abhishek, maybe this is for you. So one of the things that we have been basically hearing is in terms of consolidation and fragmentation, how would a health plan actually end up making the choice? What are the parameters that they would consider when they think about whether they want to consolidate versus go for a more fragmented strategy in terms of their outsourcing portfolio? So any initial reactions to it?
Yeah, I'm again, as you can see, I'm smiling because it relates very closely to the slots philosophy that we just laid out. In many ways, in the older philosophy, when we used to have strategic tier 1, tier 2, and staffing vendors, the consolidation versus fragmentation view was largely around creating a leader versus challenger philosophy, how to get better rates, how to look for the rock bottom prices there. Now that the philosophy amongst leaders is shifting towards best of breed in specific areas like best skills, best operating model, who can orchestrate better, who can give me specialist skills on a pipe. These are the questions which are becoming more pertinent. Hence, the consolidation versus fragmentation question does not relate to the old framework, but more to the new framework around, hey, if my operating transformation objective requires me to look at my technology estate as well as my operational estate, then I'll probably like to go in with maybe one or a few vendors, which is the consolidation philosophy under the slots umbrella, to look at all of these elements, whether it's staffing, whether it's legacy orchestration or technology transfer. But if I believe that there are different vendors which bring out best of breed in each of these areas, then probably I'll end up adopting something which is more of a distributed or a fragmented strategy. So the word fragmentation in itself seems a bit denigrating in the context of slots because we are talking about best of breed, but just keeping or staying true to the definitional meaning of or dictionary meaning of these terms, these will continue to play out depending on the transformation roadmap these organizations define for themselves. I don't know if you have any other additional commentary to provide on it.
Yeah, I think Abhishek, you covered well, but the one last piece I'll add is that I think a lot of the places what we're also saying is for a health plan, to some extent, it's also a choice between what kind of capabilities you have in-house versus what do you want to externally leverage, right?
Yes.
So a lot of health plans these days, they have their in-house capabilities through captives, through in-house operations, whether it's onshore or offshore. Plus, a lot of health plans are now getting into captives. So that is another key decision to make, that what are those capabilities where I can really benefit from having that overall control through a captive model. But at the same time, I do want to access my third-party provider for some of those capabilities where they are better fit. So that balance is another one which is pretty tricky to achieve. And depending on that, your answer to how consolidated or fragmented your vendor strategy needs to be is also getting determined. So no good answer to this one because it's not a question which is easy to answer at an industry level, but depends on how your payer operations are internally structured.
And it seems like in our excitement, we have reached the top of the hour. We could take only one question, but what we will definitely do is that all of the questions that came through will provide you offline answer for those. But as you take a look at some of the reports and research that we have done in this area, feel free to go onto the website, check those out, and reach out to us in case you have any questions on which you think we could provide additional insights or help you. So that was it from our side. Hopefully you found this helpful, informative. And when we come up with the next version of this next year, hopefully things would have advanced. Some of the things that we talked about as concepts would have become reality. Thanks for taking time out to speak with us today.